All right, I'd like to call the Finance Ways and Means Subcommittee to order for May 3rd, 2021. Madam Clerk, please call the roll.
Representatives Baum, Camper, Freeman, Gant, Hawk, Hazelwood, Lynn, Ogles, Todd, Whitson, Williams, Wendell, Chairman Hicks.
Here.
You've got a quorum.
All right, thank you very much. Members, any announcements or personal orders before we begin this morning? Seeing none, we will get right to business. Members, we do have 4 calendars today. We will first take up the TASER study calendar, then we will take up our regular sub-calendar as well as an addendum to the regular sub-calendar, and then we will finish up with behind the budget calendar. So that's where we will begin this morning. Members, let me give just a little bit of groundwork on how this will work. For the bills that have been funded, that will be the bills that we call up. If we do not call up a bill, that means it has not been funded. And at the very end, you will hear the motion to basically roll all of the bills that have not been taken up and action been taken on will basically be taken off notice at that time. So that's how we will perform today's bills that haven't been taken up. All right, with that said, we're going to take up the TASER study calendar first. So members, that's going to be House Bill 353. We're going to roll this to the Hill without objection, roll to the Hill. That brings us to item number 2 on our calendars, House Bill 1593 by Representative Miller.
Second.
I didn't see Representative Miller. Leader Camper.
Yeah. Thank you, Mr. Chairman. Mr. Chairman, I was handling this bill for Ms.
Okay, you got a motion to second. You are recognized for House Bill 353 for a brief description.
Thank you, Mr. Chairman. Mr. Chairman, with this bill would commission TASER to study the disparities of issuance of contracts to businesses and companies owned by African Americans and submit a finding to the General Assembly January 31st of 2022. I've worked with the TASER, the Secretary, the Treasurer, and both have no problems with this.
All right, thank you, Leader. And let me go back and correct myself already. I actually misspoke and said House Bill 353. We're actually on House Bill 1593 by Representative, by Leader Camper. So you got a motion to second. Members, any discussion on House Bill 1593? Seeing none, we're now voting on House Bill 1593, moving on to full finance. All those in favor say aye.
Aye.
All those opposed say no. The ayes have it. House Bill 1593 moves on to full finance. Thank you, Leader.
Committee.
All right, that brings us to item number 3. Item number 3 on our calendars, House Bill 1344 by Representative Ogles. Sir, you are recognized. You have a motion to second.
Thank you, Chairman and members of the committee. Committee, this would instruct TASER to conduct a comprehensive evaluation of childhood obesity in the state of Tennessee and the short and long-term effects of that, as well as the socio-economic impact. And we've spoken about this, I guess, since I got to the General Assembly. Tennessee consistently ranks as the worst in the nation, or maybe the highest I've seen since I've been here is we were maybe 48th. But 48, 49, 50th in childhood obesity nationally. And I think this is by far one of the largest fiscal impacts to the state of Tennessee, as well as the well-being of our constituents that we have not really quantified in this state. So with that, I'll take any questions.
All right, thank you, Representative Ogles. Members, you've heard the description and discussion on House Bill 1344. Seeing none, we're now voting on House Bill 1344, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1344 moves to full finance. Brings us to item number 4. Item number 4 on our calendar is House Bill 1389 by Chairman Todd. You have a motion to second. Sir, you're recognized.
Thank you, Mr. Chairman. This bill directs TASER to do a study on those TWRA and TDEC managed state resources that are being used for recreational activities such as paddleboarding, canoeing, tubing, and kayaking. The study will ask what amount of funding is needed to manage, sustain, and improve access to and the management of non-motor vehicle activities in the state. So it relates to the relationship between those type of sports and our other sports like fishing and other activities on the water.
All right. Thank you, Chairman Todd, for this description. Members, any discussion on House Bill 1389? Seeing none, we're now voting on House Bill 1389, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1389 moves to full finance.
Okay, thank you, members. We are on item number 1, heel of the calendar, House Bill 353. Chairman Hicks, you have a motion and a second. We're ready for a brief description of the bill.
All right, thank you, Chairman. And members, I am carrying House Bill 353 for Chairman Holsey. He is home with his father who come through surgery successful, so we're certainly glad to hear that. House Bill 353, gold bullion is the only tangible asset that does not represent somebody else's liability to repay. That becomes very valuable during tail risk events. Central banks across the world hold gold bullion as a reserve asset for this very reason. Tail risk protection should not be held inside the banking system. Thus, a Tennessee Bullion Depository provides a public good for residents of the state. The depository business plan would take into account all state expenses and therefore would be revenue positive. The state treasurer has requested that TASER conduct the feasibility study of creating a gold bullion depository in the state, and that's what House Bill 353 hopes to accomplish.
Thank you, Chairman Hicks. Members, you've heard the explanation. Are there any questions on this bill? If not, then we're voting to send House Bill 353 to full finance. All in favor say aye. Aye. Opposed? Motion passes.
Thank you, Chairman and members. All right, members, that brings us to the subcommittee regular calendar. That's going to be House Bill 1522 is going to be the first bill on there, and that's going to be by Leader Gant. Leader Gant, you have a motion and a second on House Bill 1522. Looks like there is an amendment that we need to put on to House Bill 1522, 8099. Is that correct?
That is correct.
All right, you have a motion and a second. Let's see. Do you want to describe the amendment, or would you like to go ahead and put that on and just
The amendment makes the bill.
Okay, the amendment makes the bill. So, members, any discussion on the amendment? Hearing none, seeing none, we're now voting on Amendment 8099 to House Bill 1522. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill, House Bill 1522, as amended. You are recognized, Leader Gant, on House Bill 1522.
Thank you, Mr. Chairman. And this is being brought by Speaker Sexton. And what this legislation is doing is the Tennessee Invesco program was established by the General Assembly in 2010 and was designed to increase flow of capital to innovative new companies in Tennessee in early stages of development. The return of investment for the state has been underwhelming, and the statutory end of the program is approaching. Statute requires ECD to liquidate the remaining investment starting December 31st of 23, which is the amendment changed the date from the year 2025 to 23. So that makes the bill, but does not adequately define the liquidation process. In short, this encourages liquidation of the outstanding investments by the end of 2023, effectively ending the program without forcing a fire sale that would devalue the remaining investments. And under this plan, ECD estimates that the state's return could be up to about $24 million through the end of 2025, but that has not been updated for the 2023 year, I'm sorry. And Mr. Chairman, I yield back to you.
All right, thank you very much, Leader Gant. Members, you've heard the description of House Bill 1522 as amended. Any discussion? Seeing none, we're now voting on House Bill 1522, moving on to full finance. All those in favor say aye. Aye. All those opposed, no. The ayes have it. House Bill 1522 moves to full finance. That brings us to item number 2 on our calendars, House Bill 865 by Chairman Haston. You have a motion and a second. Sir, you're recognized on House Bill 865 for a brief description.
Thank you, Mr. Chairman. This bill increases the state salary schedule by the same percentage when the General Assembly increases the B&P instructional component, and the latest fiscal note did get this to not significant. With that, I'll be glad to answer any questions.
All right, thank you very much. Members, you've heard the description. Any discussion on House Bill 865? Seeing none, we're now voting on House Bill 865, moving on to full finance. All those in favor say aye. Aye. All those opposed, no. The ayes have it. House Bill 865 moves to full finance.
Thank you, Mr. Chairman. Committee.
Thank you. All right, members, that brings us to item number 3, House Bill 678. That bill has been requested to be taken off notice. So without objection, House Bill 678, off notice. All right, that brings us to item number 4. Item number 4 on our calendars, House Bill 1501 by Representative Cochran. You have a motion and a second. You are recognized for a brief description on House Bill 1501. Looks like there's also an amendment that we need to draft for House Bill 1501 8055. Is that correct?
Chairman, that's correct.
All right, we have a motion to second. You are recognized on the amendment.
Thank you, Mr. Chairman. And this rewrites the bill. This is the school turnaround pilot project. It essentially is designed to keep schools off of the Achievement School District with some local buy-in and gives them some extra state-funded help.
All right, members, you've heard the description of the amendment. Any discussion on the amendment? Seeing none, we're now voting on Amendment 8055 to House Bill 1501. All those in favor say aye. All those opposed, no. The ayes have it. We're on the bill as amended. You've heard the description of House Bill 1501 as amended. Is there any discussion on the bill? Leader Camper, you're recognized.
Thank you, Mr. Chairman. You said the amendment made the bill?
That's correct.
Thank you.
Yes,
And
yes, ma'am.
could you describe a little bit about this pilot program?
Absolutely, yes, ma'am. It is a 4-year program. What it will do is take 5 priority schools, and those are schools that are right there on the verge of going into that achievement school district. And so essentially, they'll take those 5 schools. The state will pay for basically an organization, a company to come in and help do some training and some hands-on training. They put together a school turnaround plan. That's put together at the local level. The local LEA puts together a committee of teachers and parents and principals and school board members, and they kind of come up with a plan that they think will best fit their needs. They select a vendor to help them implement that plan, and like I said, ultimately the state pays for it, and hopefully it keeps them off that ASD list and takes them off of the priority list as well. And actually the company does not get paid their full amount unless they come off of the priority list, so there's some skin in the game.
Leader Camper.
Thank you, Mr. Chairman. You said this is a 4-year plan?
Yes, ma'am, that's
4-year
correct.
plan. And
Yes.
the locals are involved in the process all the way through?
Absolutely, yes, ma'am. Actually, the first year of the project that's the locals putting together their plan to implement.
Thank you, Mr. Chairman. Thank you, Mr. Marshall.
Thank you. Further discussion on House Bill 1501. Seeing none, we're now voting on House Bill 1501, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1501 moves to full finance.
Thank you to Chairman and Committee.
Thank you. Members, that brings us to item number 5 on our calendars, House Bill 1143. That has been requested to be taken off notice, so without objection, House Bill 1143 is off notice. That brings us to item number 6 on our calendars, House Bill 1080 by Representative Sexton of Granger. Sir, you are recognized. You have a motion second. Please continue with the brief description.
Thank you, Mr. Chairman, committee. What this bill does, it creates a physician's assistant board. Right now, the Board of Medical Examiners Committee on Physician's Assistant, and it would just change that to the Board of Physician's Assistants to regulate the practice of the PAs. That's what the bill does.
All right, members, you've heard the description of House Bill 1080. Any discussion? Chairman Todd.
Thank you, Mr. Chairman. Does this change anything with the responsibilities or oversight as far as the day-to-day oversight for physician's assistants?
No, it does not.
Thank you, sir.
Chair Lady Hazelwood.
Thank you, Mr. Chairman. And Representative Sexton, does this physician's assistant board, is it autonomous, or is there oversight from the medical board at all for this group after passage of this bill?
After this bill, it's my understanding that they will be autonomous.
Right, thank you.
All right, members, further discussion on House Bill 1080. Seeing none, we're now voting on House Bill 1080, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1080 moves on to full finance. Thank you, Representative Sexton.
Thank you, Chairman, committee.
All right, that brings us to item number 7 on our calendar, is House Bill 1320. Without objection, House Bill 1320 is being taken off notice. Without objection, off notice. All right, members, that brings us to item number 8 on our calendars, House Bill 1102 by Representative Shaw. Sir, you have a motion and a second. You are recognized on House Bill 1102 for a brief description.
Persons convicted of assaults and also persons who committed who were criminally convicted, that was eligible for diversion and at the time of sentencing. Actually, we're not changing anything in the law. What we're doing is just giving those people who did not get diversion at the time to be able to get it now, or that's what this legislation would do. Pending any other questions, I would ask to renew my motion.
All right. Thank you very much. Question's been called. Any objection calling the question? Hearing none, seeing none, we're now voting on House Bill 1102, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1102 moves to full finance.
Thank you.
Thank you. Members, that brings us to item number 9. That's House Bill 1430. That has been requested to be taken off notice without objection. So moved. That brings us to item number 10. Item number 10 on our calendars, House Bill 980 by Chairman Williams. That has been requested to be taken off notice. So without objection, House Bill 980 will be taken off notice. So moved. That brings us to item number 11. Item number 11 is House Bill 1009. That has been requested to be taken off notice without objection. So moved. All right, members, that brings us, and I appreciate your patience this morning. We just want to make sure we get this right as we go so that we don't have to come back and fix a mistake. Members, that brings us to the addendum calendar this morning. That is going to be item number 1 on the addendum calendar. That's going to be House Bill 829, and I do not see the sponsor, so we're going to roll this to the heel of the behind the budget calendar. Without objection, so moved. That brings us to item number 2 on the addendum calendar. That's going to be House Bill 1267 by Representative Gillespie. Sir, you have a motion and a second. You are recognized for a brief description.
Thank you, Mr. Chairman and committee. Under present law, the Board of Directors of the Tennessee Education Lottery enforce and supervise compliance with laws and rules regulating the regulation of controlling wagering and sports events in the state. What this bill is doing is it would flip those roles, basically giving the Sports Wagery Advisory Council sole autonomy, separate from the Education Lottery Board in making decisions on sports wagering in the state. With that, I welcome any questions.
All right. Thank you, Representative Gillespie. Members, you've heard the description on House Bill 1267. Any discussion on House Bill 1267? Speaker Sexton, you're recognized.
Thank you, Mr. Chairman. Members, this bill was worked out with the administration, the Senate, and the Lottery Board as a mechanism to have the gaming board become an independent entity outside of the Lottery Board. So it's making it a new board. That's all it's doing. Thank you all.
All right. Thank you very much. Further discussion on House Bill 1267. Seeing none, we're now voting on sending House Bill 1267 on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1267 moves on to full finance. All right, members, we're going to go back to item number 1 on the addendum calendar. Item number 1 is House Bill 829. That bill has been requested to be taken off notice, so without objection, House Bill 829 off notice. All right, members, that brings us now to the behind the budget calendar. So we're going to be on the behind the budget calendar. We're going to be on item number 1. That's House Bill 1047 by Speaker Sexton. We have a motion, a second. Sir, you're recognized on House Bill 1047.
Thank you, Mr. Chairman. Sorry about that. Just working the angles over here. I'm sorry. Mr. Chairman, what this bill does is this the truth in sentencing bill that we worked on that was funded in the budget to the tune of about $24 million. It still allows the judges the discretion for sentencing, or the trial court or the jury to determine what the sentencing is. Once they determine that sentencing, there's a whole list of crimes here, A through EE, historically crimes against women and children, and it would make those crimes 100% of sentencing. And that's what this bill does. I'll be happy to take any questions.
All right. Thank you, Speaker Sexton. Members, you've heard the description of House Bill 1047. Any discussion? Leader Camper.
Thank you, Mr. Chairman. Mr. Speaker, you did say that we were not taking away the ability of the judges to have some input and leverage as to the sentencing. It's just a matter of whatever they decide, that's what it's going to be.
Correct. So currently in statute, the sentencing guidelines are very complex, and once we started looking at it, we realized we didn't want to go in and start messing with it. So right now, depending on the type of offender it is and the type of felony it would be, there's a range that they can consider. We're not taking away the range or anything like that. All we're saying is if it's an 8 to 12 year potential and the judge or a jury gives 9 years, then they have to serve 9. We're not taking away the discretion of the range or where they fall.
Thank you, Mr. Speaker.
Thank you. Further discussion? Seeing none, we're now voting on House Bill 1047, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1047 moves to full finance. Thank you, Mr. Speaker. Item number 2 on our calendars, House Bill 430 by Leader Lambert. Do you have a motion to second? Sir, you are recognized for a brief description on House Bill 430.
Thank you, Mr. Chairman. And this, just like the last bill, but in a much smaller format, will increase the sentencing on facilitation of rape of a child. That's currently a 30% parole-eligible sentence, and this will significantly increase that to where, in essence, it's an 85%. It's 100%, but there is some release eligibility.
All right, thank you very much. Members, any discussion on House Bill 430? Seeing none, we're now voting on House Bill 430, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 430 moves to full finance.
Thank you, Mr. Chairman.
Thank you. That brings us to item number 5 on our calendar. Item number 5 is going to be House Bill 948 by Chairman Boyd. You have a motion to second. Sir, you're recognized on House Bill 948 for a brief description. And Chairman, it looks like there is an amendment that we need to attach to House Bill 948, and it looks like that drafting code is 7935. Is that correct?
Mr. Chairman, that is correct.
All right, do we have a motion to second on the amendment? We have a motion to second. You are recognized on the amendment.
Thank you, Mr. Chairman. The amendment makes some very minor technical changes to the bill, nothing substantial at all.
All right, thank you very much. Members, any discussion? Seeing none, we're now voting on Amendment 7935 and going on to House Bill 948. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. And, sir, you're recognized on the bill as amended.
Thank you, Mr. Chairman. House Bill 948 brings some much-needed, well-thought-out reform to the Certificate of Need process in Tennessee. It essentially reduces paperwork, makes the process quicker, easier. It costs less for people seeking to get a Certificate of Need. It eliminates some of the protectionist aspects of Certificate of Need, creates greater flexibility. It lowers the population threshold for counties that are exempt from it on non-pediatric MRI services and PET services from 250,000 down to 175,000. And one of the big things is it requires the HSDA executive director to develop a plan to merge Certificate of Need with healthcare licensure into a single agency, and that plan must be submitted to the General Assembly for action no later than January the 1st of 2023. Mr. Chairman, I'll take any questions.
All right. Thank you, Chairman Boyd. Members, any discussion on House Bill 948? Leader Gant.
Thank you, Mr. Chairman. Representative Boyd, I know we've talked about this bill several times. I just want to be on record that the county that I represent, McNairy County, had a former hospital that closed, and this legislation would allow another entity to come in and place a hospital in that county if they had a former hospital that closed. Is that correct?
Chairman Boyd.
Thank you, Mr. Chairman. And your specific situation, I'd have to get more details on, but that is, as we talked about it before, I believe this bill would take care of that for you.
Leader.
Okay, thank you.
Further discussion? Leader Camper.
Thank you, Mr. Chairman. Representative, with respect to a hospital that's closed, let's say there's a rural hospital that closed, and that hospital decides at some point they want to reopen, what happens with their certificate of need? Do they have to reapply? Do they have to go through a full process? How does that hospital get to reopen? And is there a time limit or around that?
Chairman Boyd.
Thank you, Mr. Chairman. If they are in a distressed county, Certificate of Need would not apply at all. But if they are seeking to open and they are under the population threshold of 175,000, they would have to go through the Certificate of Need process.
Leader Camper.
Thank you.
Further discussion, House Bill 948. Seeing none, we're now voting on House Bill 948, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 948 moves to full finance.
Thank you, Chairman, Committee.
All right, that brings us to item number 8 on our calendar. Item number 8 is House Bill 419 by Chairman Subcommittee. You have a motion and a second. Sir, you are recognized on House Bill 419 for a brief description.
Thank you, Mr. Chairman. House Bill 419 adds chiropractic care to the coverages of those over the age of 18 for TennCare. With that, Mr. Chairman, I'll answer questions.
All right, members, you've heard the description of House Bill 419. Any discussion on House Bill 419? Hearing none, seeing none, we're now voting on House Bill 419, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 419 moves to full finance. All right, that brings us to item number 9 on our calendars, House Bill 6 by Chairman Subcommittee. Sir, you have a motion and a second. You're recognized on House Bill 6. Looks like there's an amendment that we need to attach, drafting code 8070. Is that correct?
Yes, sir.
You have a motion and a second. You're recognized on the amendment.
Thank you, Mr. Chairman. The amendment creates the funding mechanism for this college coaching initiative and completion grants. I'll be happy to answer questions on the amendment.
All right, any discussion on the amendment? Hearing none, seeing none, we're now voting on Amendment 8070 to House Bill 6. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended, and you are recognized on the bill as amended.
Thank you, Mr. Chairman. Committee, this is the college coaching initiative or the completion grant that we've been working on for 3 years. Our graduation rate in Promise has dropped to 51%. One of the major contributors of that is the students that are in the college coaching initiative, the ones that experience the most risk of life coming up and biting them and getting them to drop out. Our hope here is this 4-year pilot program with THAC is that we can get these kids across the finish line, and hopefully in 4 years we can come back and report to you that this has been a huge success. We are now in the 70s to 80% graduation rate, which would lead the nation in education. Mr. Chairman, I'll answer any questions.
All right, thank you very much. Members, you've heard the description of House Bill 6 as amended. Any discussion on House Bill 6? Chair Lady Hazelwood.
Thank you, Mr. Chairman. I just want to say I'm excited that we were able to work out funding for this bill because I, like you, have probably met with presidents of our local community college and other folks who work there, and they have explained how these expenses that for most of us would be a minor inconvenience are sometimes hurdles that these students can't overcome if their car has an issue or their rent's overdue or whatever, and that can be a huge barrier to them completing their education. So I think these grants will allow them to deal with those issues, continue to stay in school and be ready to get a job and be employed by the employers that are out there waiting for them. So thank you.
Thank you very much.
All right, thank you. Further discussion on House Bill 6? Seeing none, we're now voting on House Bill 6, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 6 moves to full finance.
Thank you, Chairman.
Thank
Committee.
you. Members, that brings us to item number 13. Item number 13 is House Bill 744 by Chairman Curzio. Sir, you have a motion and a second, and you are recognized on House Bill 744 for a brief description. And Chairman,
Thank you, Mr. Chairman. Thank you, committee. I do have an amendment coded 8120 that we filed with the committee this morning.
Yes, sir. We have a motion and a second on the amendment. You're recognized on the amendment for a
Thank you very much, committee. Members, this amendment does remove any fiscal impact to the state, would help create victim spaces in courthouses across the state where those spaces do not currently exist, and will be able to be funded out of existing resources from the Tennessee Attorney General's Conference.
All right, thank you very much. Members, any discussion on the amendment? Question's been called. Any objection called to the question? Hearing none, seeing none, we're now voting on Amendment 8120 onto House Bill 744. All those in favor say aye. All those opposed, no. The ayes have it. We're back on House Bill 744 as amended. You are recognized, sir.
Thank you, Mr. Chairman, and the amendment made the bill, so I renew my motion.
All right, members, any discussion on House Bill 744? Question's been called. Any objection called on the question? Hearing none, seeing none, we're now voting on House Bill 744, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 744 moves to full finance.
Thank you, Chairman and committee.
All right, that brings us to item number 15 on our calendar. Item number 15 is House Bill 904 by Chairman Doggett. Sir, you have a motion and a second. You are recognized on House Bill 904 for a brief description.
Thank you, Mr. Chairman and committee. 904 looks at expanding protection orders for witnesses or victims of sexual offenses and witnesses expected to testify against a defendant in court. Requires petition to be certified and supported by an affidavit of the victim informing the witness, and specifies that good cause for issuing such protective order may include allowing the defendant to publish information likely is to result in coercion or intimidation of a witness or victim.
All right, thank you, Chairman Doggett. Members, any discussion on House Bill 904? Hearing none, seeing none, we're now voting on House Bill 904, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 904 moves to full finance.
Thank you very much.
Thank you. All right, that brings us to item number 16 on our calendars, House Bill 1130 by Chairman Farmer. You have a motion and a second. Chairman Farmer, you are recognized on House Bill 1130 for a brief description.
Hey, thank you, Mr. Chairman. Committee. It also has an amendment traveling with it that coded 7378. Is that on it?
Yes, sir.
It is?
Yep.
Okay, very good. And members, and Mr. Chairman, what this does, this creates a statewide chancery court consisting of a chancellor in each grand division, the Eastern, Middle, and Western District. And what this chancery court would do, it would take up issues of statutory interpretation or any constitutional issues that's raised against the state of Tennessee. So with that, I renew my motion.
All right, thank you, Chairman Farmer. Members, any discussion on House Bill 1130? Representative Freeman, you're recognized.
Yeah, thank you. So explain to me the process. How would this be, would they be, clearly they'd be elected positions, right? Or are they appointed?
Chairman Farmer.
Yeah, thank you, Mr. Chairman. And Representative Freeman, thank you for that question. Well, the way this would work is the governor would initially appoint these three, and then once they'd be elected statewide. So when the governor's on the ballot again in 22, they would then be on the ballot and they'd be elected by popular election.
Representative Freeman. Further discussion on House Bill 1130. Leader Camper, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, just for the record, could you explain to us why we are creating this three-member Chancery Court, for the record?
You're recognized,
Yeah,
Chairman.
thank you, Mr. Chair. And it's my understanding that, in my opinion, this would spread out and create fairness all across the state. You have a chancellor from the Eastern District, the Middle District, and the Western District opining on issues that affects the entire state. So that's why.
Leader Camper.
Thank you, Mr. Chairman. And Mr. Chairman, for the record, this bill is not being proposed to, I should say, deal with any court decisions that's just been made, or a reflection of any decisions that maybe we've had some problems with. That's not why we are doing this. Is that a correct assumption, Mr. Chairman?
Chairman Farmer.
And thank you, Mr. Chairman. And Leader, no, it's my understanding that this is just what I had just explained, just to spread out the fairness across the state and have those opinions heard.
Thank you,
Leader.
Mr. Chairman.
Thank you. Representative Whitson.
Thank you, Mr. Chairman, and thank you, Chairman. Do you feel that this bill has as the authorization for funding provides enough staffing for these three positions?
Chairman Farmer.
Yeah, and thank you. And I believe that the AOC has looked at that, and I believe we came back, and there's an amended proposal there for those monies, and that's been funded.
Okay, thank you. Thank you, Mr. Chairman.
Thank you, Representative. Further discussion? If not, we will now vote on House Bill 1130, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1130 moves to full finance. If you'd like to be recorded as a no, please make sure the clerk records you as so. Right here. We got you. We got you. All right, that brings us to item number 17 on our calendars, House Bill 1132 by Chairman Farmer. Sir, you have a motion, a second. You're recognized on House Bill 1132 for a brief description. And just to let you know, we already have drafted Amendment 76212 to the bill, so you are in the proper posture and ready for a description.
Oh, and thank you, Mr. Chair and committee members. What this does, this sets up an abatement council and sets up how the state is going to deal with proceeds from certain settlements and with regards to the lawsuits and of the opioid distributors and one manufacturer.
All right, thank you for this description. Any discussion? Chairman Williams.
Thank you, Chairman Farmer. I appreciate this. And if it makes you more comfortable for us to go out of session, I made sure the AG staff was on the list to discuss today. I just had a couple clarification questions. On the spreadsheet that you sent to our offices, it showed a 40-60 split as it relates to local governments versus the state. Is that still the instance with this this amendment that we just put on?
Chairman Farmer. As my understanding, that has not changed.
Okay.
It's still a 60-40 split.
Yep. And that 60-40 split is encompassed by guaranteed 15% to local counties and then a possible 25% of a 70% of the original.
Chairman Farmer.
And thank you, Mr. Chair and Chairman Williams. Now, that 15% will go directly to locals, 15% will go directly to the state, and really that 70%, every bit of that's going to end up back with the locals, but there's another 35% of that 70 that's going to go to the abatement fund that's going to be guaranteed, and that's how we're going to end up with that 40%. But really, all the abatement fund is going to end up back with the cities and counties. They're just going to need to make those requests to spend that money certain ways, and they're going to have a list of treatment programs and such that are certified, and it's going to help folks get well.
Chairman Williams?
Thank you. I recognize that, and I recognize you're here because the Attorney General hopes to settle these lawsuits, and we're thankful for that. I have a little bit of a concern, though, as it relates to the 70% set aside that the abatement fund, the abatement council would do, because technically, statutorily, it's a good faith promise that those monies will go back to the communities of which they were originally intended to. The only guarantees based upon counties that I understand is the original 15% you described, which goes to the state or goes to the counties, and then another 15 goes to the state. But of the balance of the 70%, the committee would have to agree to be able to send that additional 25% to make the 40 for that to be the case. If the council didn't agree or they didn't feel like it was appropriate to fund, then the county, in fact, would not get the money, I suppose.
Chairman Farmer.
And, Mr. Chairman, thank you, Chairman Williams. That's my understanding.
Okay. I guess my final question is I'm concerned about this only because we haven't settled the loss. Oh, I do have one other question. My apologies. Are the endo settlements still carved out as it relates to those three state lawsuits, all three lawsuits that were for the local counties?
Chairman Farmer.
Yes, that's my understanding.
Okay, and then the balance of the 70%, can you speak to the fact is that will any of the people paying the settlement to the state be able to acquire any of the 70% of the funding that goes to the abatement council?
Chairman Farmer.
Okay, could you repeat that? I don't understand.
Yeah, so let's say I'm a pharmaceutical company. I'm sued because, unfortunately, in my community, I got to handle an NAS child that desired an opioid more than it did its mother's breast when it was born. I guess my question is does any of the 70% go back to the people that we settled with for treatment?
Chairman Farmer.
I do not know the answer to that question. If you want to.
I appreciate the question. I understand the AG's here today. We may ask that in full, but my concern would be that the 70% that went to the abatement council, that the same people that prescribed these opioids and said they were safe may have created a fix for the opioids that have impacted our communities, and they in fact could get monies out of the 70% of the balance. And so I hope that's not the case. Hopefully they can answer that in full, but that's a concern of mine.
Yeah. Mr. Chairman, I certainly wouldn't think that was this obviously is not the intent to send monies back to the folks who have gotten people addicted to opioids, so.
Thank you, Chairman Farmer.
You're welcome. Thank you.
Thank you, Chairman Williams. Representative Hall.
Thank you, Mr. Chairman. And quick question: if any of our localities have attorneys already outside the one issue that we just spoke about with Endo, if there are attorneys' fees associated with any community right now, that comes outside of the scope of these dollars that we're talking about? I think there's a question there. Do any attorney fees, outside attorney fees, go outside the scope of the funds we're talking about?
Chairman Farmer.
And thank you, Mr. Chairman and Chairman Hawk. To that, this legislation only has to do with McKesson Corporation, Cardinal Health, AmerisourceBergen Corporation, and Johnson & Johnson. So you got three distributors and one manufacturer there. And it's my understanding that this is by agreement. I've had no one call my office to oppose this. So with regards to your question, I think that all this legislation encompasses is just settlements with these four here and subsidiaries thereof.
Chairman Hawk. Further discussion, House Bill 1132. Seeing none, we're now voting on House Bill 1132, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1132 moves to full finance.
Thank you.
Thank you. All right, that brings us to item number 20. Item number 20 on our calendar is House Bill 745 by Chairman Haston. You have a motion, a second. You are recognized on House Bill 745 for a brief description. It looks like there is an amendment that we need to attach to House Bill 745, drafting code 8086. Is that correct?
Yes, sir.
Okay, you have a motion, a second. You are recognized on the amendment.
Thank you. What the amendment does is it changed from subject to available funding to subject to available federal funding.
Okay, any discussion on the amendment? Question's been called. Any objection calling the question? Hearing none, seeing none. We're now voting on Amendment 8086 to House Bill 745. All those in favor say aye. All those opposed, no. The ayes have it. We're back on House Bill 745 as amended, and you are recognized, Chairman Haston, on
Thank
House
you, Mr.
Bill.
Chairman. What this bill does offer our high school seniors the opportunity to take a nationally recognized career readiness assessment at no cost to the student. With that, I'll be glad to answer any questions.
All right, thank you, Chairman. Members, any discussion on House Bill 745? Leader Camper.
Thank you, Mr. Chairman. Thank you for the bill. I agree that we should be doing that. My question is around the funding. So did you just, in the amendment we put on, did it limit the funding to money coming from the federal government?
You're recognized, Chairman.
Thank you for that question, Leader. Yes, right now we have a 2-year window to use some federal funding to go towards this. We're hoping that the information that we get back shows that it's a successful program and we can find some recurring funding, but we do have a 2-year window to be able to use this to make sure our students for at least the next 2 years have the opportunity to take the test and get connected to the workforce.
Leader Camper.
Thank you, Mr. Chairman. Thank you for the explanation. So my concern is that when this 2 years is over, would this be an unfunded mandate that we're going to put on locals to continue or try to find the funds? Could you speak to that?
Chairman Haston.
I believe the bill would end at the end of as it's written now. The bill would end and the mandate would end at the end of the funding permitted that we hopefully find some recurring funds.
Leader Camper.
Thank you, Mr. Chairman. At the end of the 2 years, there will be some sort of report on the success. And then based on that, we would look at trying, if it proves to be successful, then we would look at trying to find additional funds to keep the program going. Is that what I'm hearing you say?
Chairman Haston.
Yes, ma'am. That's my hope.
Thank you, Mr. Chairman. Thank you, Mr.
Thank
Sponsor.
you. Further discussion on House Bill 745. Chair Lady Hazelwood.
Thank you, Mr. Chairman. I want to thank the representative for bringing this bill. In my area, certain employers have been using this work keys for quite some time. It's proven very effective. Unfortunately, the high school diploma, they're not always convinced that it does what it says it does. With work keys, there's no question that these folks are ready to do whatever it is they're hiring them to do. So thank you for bringing this.
Thank you.
Yes, sir.
I will just say thank you for the comments. And there's 800 employers in Tennessee that rely on this and make decisions on hiring. And it just is it's a great opportunity for our students to get directly connected to the Tennessee workforce.
Thank you, Chairman. Further discussion on House Bill 745. Seeing none, we're now voting on House Bill 745, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 745 moves to full finance.
Thank you, Mr. Chairman. Committee.
Thank you. Brings us to item number 21 on our calendar. Item number 21 on our calendar is House Bill 1398 by Chair Lady Helton. You have a motion and a second. You are recognized on House Bill 1398, and it appears as though there is an amendment that we need to attach to House Bill 1398.
Yes, Amendment 8088.
Will you have a motion and a second? You're recognized on the amendment.
Thank you. This covers two areas. Due to some concerns from TennCare and the state employee plan, this amendment clarifies that PBMs do not need to change the payment methodology for reimbursements to pharmacies, but outlines an appeal process for pharmacies if paid below the actual cost. And it also clarifies that the acceptable format for data to be provided to the requesting entity are in a standard that is accredited by the American National Standards Institute, a common standard in the industry today. And TennCare and the state employee plan are deferred now on the legislation.
All right, thank you very much. Members, you've heard the description of the amendment 8088. Any discussion? Hearing none, seeing none, we're now voting on putting the amendment 8088 onto House Bill 1398. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended, and you are recognized, Chair Lady, on House Bill 1398 as amended.
Thank you, Mr. Chairman. Section 1 of the bill addresses 340B discrimination. 340B entities are safety net providers that serve the state's most vulnerable populations. PBMs can amend a 340B entity's contract and reimburse at a lower rate than negotiated essentially withholding money from indigent care facilities. This section of the bill will prohibit PBMs from discriminating against these entities so that nearly 700 340B providers in the state can continue to provide services to the community without financial constraints. Section 2 of the bill addresses specialty pharmacy discrimination and patient steering. Many PBMs own or are owned by the pharmacies they require consumers to use. These PBMs steer patients to their preferred network of affiliated hospitals, providers, and pharmacies in order to maximize their profits. PBMs can mandate that you obtain your specialty infusion or other pharmaceutical drugs from their preferred specialty networks or PBM-owned pharmacies, even if the patient experiences adverse care through drug waste, incorrect dosage, or delays in medication. This section of the bill puts choice back into the hands of the patients, specifically those that are suffering with chronic, complex, or rare diseases. Section 3 addresses spread pricing and rebate retention. Spread pricing occurs when a PBM charges a health plan more for a certain drug than it reimburses the pharmacy dispensing the drug, artificially inflating the cost. This practice results in higher costs to the consumer while allowing PBMs to divert fees for profit. It is most common with cheaper generic drugs. PBMs receive rebates by offering different types of placement on health plan formularies. The rebate passes through the PBM to get to the plan, and the PBM retains a portion of the rebate as part of its contract. This section of the bill ensures the price reduction negotiated by the PBM passes through the pharmacy directly to the consumer, and that pharmacies are no longer paid below their acquisition cost. Section 4 and 5 addresses transparency. This provision states that a PBM has a responsibility to report any entitlement benefit percentage to both the plan and covered person that either are entitled to. This section of the bill will remove the opaqueness within the PBM system by freeing up data to provide accurate information to patients at the point of care, empowering discussions and decisions about medications a patient can afford and what it is going to cost.
All right, Chair Lady, thank you for this description. Members, any discussion on House Bill 1398? Speaker Sexton, you're recognized, sir.
Thank you, Mr. Chairman. Representative, thank you for bringing this reform bill to us. Members, I think this is probably one of the biggest reform bills that we've seen in a long time. I think she brought it due to a recent Supreme Court case, Rutledge versus PCMA, where Arkansas passed a law. They got challenged with the ERISA plans, but the Supreme Court ruled unanimously, let me just make that clear, 8-0, that the states have the ability to control escalating healthcare costs that are being driven by PBMs. So let me just think about what happened. Arkansas passed PBM reform, went to the Supreme Court, 8-0 ruled Arkansas has the ability to control healthcare costs through a PBM. What we have in this state, and we've been working on this type of legislation for years, is we have a middleman in between the patients, the pharmacists, and the healthcare plans. And what they've been doing is taking rebates, not discounting them back to the plan or to the patient or the customer or the pharmacy. A lot of times they provide benefits, but the pharmacist gets reimbursed less than their actual cost. And I know a lot of you on this panel up here are business owners. How long can you stay in business if they're reimbursing you less than what your actual costs are? All this bill is a good government bill that will allow the state to once and for all to say we need to treat our pharmacists, all of them, the same, not independently from one another, because right now PBMs have the ability to have different reimbursement rates depending on the pharmacy. They're not treating them all the same. And they have their own pharmacies, and they treat them different than your independent pharmacists in your community. They have their own specialty pharmacies. They treat them differently than the ones who are owned in the state of Tennessee. This bill is a transparency, good reform bill that will not drive up healthcare costs. What this bill will do is actually help the consumers and the pharmacists. It still allows them to do mail order if they want to. That's misinformation that's being held out there right now. This does not affect mail order. But let me just thank the representative for bringing this bill. I know there's a lot of information out there. I look forward to being here for full committee during testimony. But this is one of the biggest reforms that we have, and right now 30 other states 30 are pushing legislation like this in their states. Thank you.
Thank you, Speaker Sexton. Chair Lady Hilton, would you like to respond?
I would just like to echo what Mr. Speaker said. For the year 2021, 81 bills have been proposed in 29 states related to pharmacy benefit manager practices. There has been much concern in Tennessee regarding PBMs, but little action. Mr. Chairman and members, now is the time to take action. With that, I renew my motion.
Thank you very much. Representative Baum.
Thank you, Chairman Hicks. Chair Lady Hilton, to what extent are ERISA employers covered by your bill? And as maybe a follow-up question to that, you mentioned an appeals process for prices that could be used by TennCare. Would ERISA employers have access to this appeals process as well?
I do not know the answer to that.
Speaker Sexton.
Thank you. The appeals process covers when a pharmacist wants to appeal what they're getting reimbursed for. What I will say is the Supreme Court decision, it was based on an ERISA lawsuit. And what they said in the lawsuit, let me just make sure I get this right. ERISA did not pre-exempt Arkansas's law regulating PBM. What you've heard for a long time from PBMs who are working for an ERISA plan is that they don't apply to the any willing pharmacist statute that we have in our state of Tennessee, which means they can set costs for your farm. You could have 5 pharmacies in your town, and they all have different price points in that community. What this bill really does is try to set a level playing field so that all pharmacists have the same ability, the same contract with one another. And so the ERISA plans, that's the one argument they always make, but the Supreme Court ruled that they should be treated like everybody else under state law.
Okay.
Chairman Baum.
Thank you.
Leader Camper.
Thank you, Mr. Chairman. Chairman, you mentioned earlier about safety net.
Yes.
So would this bill help consumers to lower the cost of pharmacy in their family?
Chair Lady, you're recognized.
Are you referring to the safety net providers?
Yes.
Well, this just prevents the PBMs from reimbursing safety net providers at a lesser rate than non-safety net providers. And our 700 covered entities in Tennessee are very dependent on the savings because they use those savings to reinvest in other programs for their uninsured or underinsured people that come to their facilities.
Leader Camper.
Thank you for that response. Thank you, Mr. Chairman.
Thank you. Further discussion on House Bill 1398. Question's been called. Any objection to calling the question? Hearing none, seeing none, we're now voting on House Bill 1398, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1398 moves to full finance. Thank you, Chair Lady.
Thank you.
Brings us to item number 22 on our calendar. Item number 22 is House Bill 330 by Chair Lady Hilton. You have a motion and a second. You're recognized on House Bill 330 for a brief description.
Thank you, Mr. Chairman. This bill seeks to extend the payback period from 30 to 35 years during which a certain portion of state sales taxes are allocated and distributed to a municipality or industrial development corporation that finances the development of an extraordinary retail or tourism facility project under the Act.
All right. Thank you very much for this description. Members, you've heard the description of House Bill 330. Any discussion? Seeing none, we're now voting on House Bill 330, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 330 moves to full finance.
Thank you, Mr.
Chair
Chairman
Lady.
and members.
That brings us to item number 23 on our calendar. Item number 23 is House Bill 1433. And I don't know if Chairman Holtzclaw has arrived just yet, so without objection, we will roll him to the heel of the behind the budget calendar. Without objection, so moved. That brings us to item number 27, House Bill 417 by Chair Lady Littleton. There she is. Chair Lady Littleton, you are recognized on House Bill 417. Do we have a motion and a second? You have a motion and a second. You're recognized for a brief description.
Thank you, Mr. Chairman and committee. This bill says knowingly allowing a child to be within a structure where any of the following controlled substances are present and accessible to a child. Any Scheduled I controlled substance, cocaine, amphetamines, or fentanyl.
All right, thank you very much for this description. Members, any discussion on House Bill 417? Seeing none, we're now voting on House Bill 417, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 417 moves to full finance. Brings us to item number 28 on our calendars, House Bill 427 by Chair Lady Littleton. You have a motion to second. You are recognized for a brief description on House Bill 427.
Thank you, Mr. Chairman and committee. Under present law, the Class E felony of sexual battery is unlawful sexual conduct with a victim by the defendant or the defendant by a victim accompanied by any of the following circumstances. Force or coercion is used to accomplish the act. The sexual contact is accomplished without the consent of the victim. The defendant knows or has reason to know that the victim is mentally defective, mentally incapacitated, or physically helpless. This bill adds that the sexual contact with the victim occurs during the course of a consultation, examination, ongoing treatment, therapy, or other provision or professional service described. The defendant, whether licensed or not by the state, is a physician, psychologist, psychiatrist, therapist, social worker, nurse, chemical dependency counselor, member of the clergy, or any other person that provides or purports to provide treatment for a mental, emotional, or physical condition.
All right, thank you very much for this description. Members, any discussion on House Bill 427? Representative Freeman.
Thank you, Chairman. And just so that I make sure I'm fully understanding, this is any relationship with any of these, it's the relationship with the therapist or the clergyman or the social worker. It's not the individual's inability to make the consenting decision. Is that, I'm asking that clearly? Is it somebody that's of limited mental capacity that they have to know, or is it just if you have this professional relationship, then you can't consent?
It's meant, the intent is if they are incapacitated. If they're there for mental help or for treatment, then it's okay if they're not there for after the treatment, but they shouldn't be involved with a patient while they're under their treatment.
Great. Thank you.
All right, further discussion on House Bill 427? Seeing none, we're now voting on House Bill 427, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 427 moves to full finance. All right, that brings us to item number 30. Item number 30 on our calendars, House Bill 951 by Chair Lady Littleton. You have a motion to second. You're recognized for a brief description.
Thank you, Mr. Chairman and committee. This creates a name misdemeanor for the offense of neglect. I can't talk today. By act or omission engaged in the conduct that places a child in imminent danger or death, bodily injury, or physical or mental impairment. It creates a Class D felony if the offense is that places a child that is 8 years of age or less in imminent danger, death, bodily injury, or physical or mental impairment. This was brought to me by the DAs last year and got caught up in the COVID.
All right, thank you, Chair Lady, for this description. Members, any discussion on House Bill 951? Question's been called. Any objection called on the question? Hearing none, seeing none, we're now voting on House Bill 951, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 951 moves to full finance.
Thank you, Mr. Chairman and committee.
All right, members, item number 32 on our calendar will be the next bill up, House Bill 656, and that's going to be by Chairman Moon. Sir, you have a motion and a second, and you are recognized for a brief description. And it looks like there's an amendment that we need to put on this House Bill 656. It's going to be drafting code 8093. Is that correct?
That is correct, Mr. Chairman and members. The amendment deletes the language from the original bill to remove the stipend and reimbursement scheme for certain persons. And that was a sticking point. That will eliminate the $149,500 fiscal note, sir.
All right, thank you very much. And you do have a motion and a second. Members, you've heard the description of Amendment 8093. Any discussion? Hearing none, we're now voting on House Bill 8093. We're now voting on the amendment 8093 to House Bill 656. I'll get it right. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. Sir, you're recognized on the description.
Thank you, Mr. Chairman, members. All this does, this bill puts the municipal certified finance officers on the same program as the county certified financial officers. 2007, the municipalities were put under this program. It was very punitive. It wasn't optional. 10 years later, the counties came under a program similar, and it was optional, provide a stipend. So they just put these equal. Now both programs will be 16 hours of continuing education.
All right. Thank you very much for this description. Members, any discussion on House Bill 656? Seeing none, we're now voting on House Bill 656, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 656 moves to full finance.
Thank you, Mr. Chairman.
Thank you, Chairman. All right, that brings us to item number 35. Item number 35 on our calendar is House Bill 1039 by Chairman Vaughn. You have a motion and a second. You are recognized for a brief description, and it looks like you've got an amendment that we need to attach to House Bill 1039. That amendment that I have is 6977. Is that correct?
We have the same amendment, Mr. Chairman.
Well, let's roll with that one. Is there a motion? Motion. It's already been adopted?
Yeah, I thought we adopted it before we parked behind the budget.
Well, you are correct, and I was just checking to see if you were paying attention. You are recognized. You passed the test. You're recognized for a description, sir.
Thank you, sir. This is an Unemployment Trust Fund Reform Act. Prior to the pandemic, our fund was ranked the 31st, I guess you could say the 19th least solvent trust fund in the country by the Department of Labor. As we know, the pandemic required an infusion of CARES Act money to keep the solvency up. The bill you have in front of you today contemplates a $25 a week benefit increase, yet the duration of the benefits will be tied to the unemployment rate at the time. Begins at, currently we have 26 weeks guaranteed. What this will do is reduce the amount of guarantee from 26 weeks to 12 weeks if we're 5.5% unemployment or less, and then for each 0.5% it grows, it would increase. We have contemplated giving the Department of Labor an extraordinarily long time period to deliver this. It would come into effect December of 2023. So with that, we believe that all the COVID issues will have come through the pipeline and we can begin afresh. And so that's what 1039 does.
All right, thank you very much for this description. Members, you heard the description. Any discussion on House Bill 1039? Seeing none, we're now voting on House Bill 1039 moving. Oh, I'm sorry. Leader Camper.
I'm sorry, Mr. Chairman. I thought you saw my hand. Representative, you know, I've had concerns about this bill, about cutting to 12 weeks, when oftentimes you have people whose particular career field is difficult to find employment if they were impacted by some pandemic or anything else that their career field was impacted by. And so they may need the extra weeks, you know, to get reemployed. So I'm wondering, why did we choose 12 weeks to cap from 26? Why did we cap it at 12? And does this deal with just across the board, or if you're in a particular career field where you just haven't, regardless of what the unemployment rate is, you're just having a hard time trying to get employment?
Chairman Vaughn.
Leader, the bill contemplates a situation to where it follows the premise that if unemployment is low, then it should be easier to find a job in an opportunity where there are more jobs available. We see today there's almost 250,000 jobs on Jobs for Tennesseans. We're seeing restaurants not being able to reopen because they can't find people to work. We're seeing orders in warehouses not being able to be fulfilled because there's no warehousing workers. And why? Is because the government has created a competitive playing field with businesses. And I guess it gets to the core function of, is unemployment a bridge to a better, through a rough patch, or is it adopting a new lifestyle? And that's kind of, unfortunately, we're loving people in this environment trying to do the right thing. We're heaping benefit upon benefit, and unfortunately, there's a negative reaction into it in some places. This is our first attempt to try to bring that in with regards to benefits here in the state. Now remember, it starts at 12 weeks, but it can go back up to 20, all depending upon the amount, what the unemployment level is. And so when we looked at it, frankly, it's a math equation. It's how do you replenish a trust fund that needs more money into it? You can't do that by continuing your expense level at the same rate. And so what we're trying to do is keep our businesses competitive, yet also offer people who are going through a rough spot an opportunity to help lessen some of that burden.
Leader Camper.
Thank you, Mr. Chairman. I understand there's a perception that people aren't looking for jobs in this market because they believe that, the government is paying them X amount of dollars. I don't think that's preponderance of the people. It may be a few people that's doing that. I'm not going to argue that point. A lot of these other jobs that's being offered that you're talking about there are barriers for some people in getting those jobs. So I think we need to consider that as well. And if I heard you correctly, the 12 weeks, which was my question about why we capped it at 12, the 12 weeks is if unemployment is at 5.5?
5.5 or less.
Okay, 5.5 or less, then that's when the 12 weeks would kick in, if you will. And if it's above that, it will be at the 20-week level. Explain that to me.
For each 0.5%, it will rise a week.
Okay. All right. So at 6%, then it will go to 13 and so forth,
Yes, ma'am.
all the way up to 20. 20 is still the cap versus the 26.
That's correct.
I'm sorry, Mr. Chairman.
You're fine.
Thank
Continue.
you, Mr. Chairman. I didn't mean to have a running debate. Say that again. I'm sorry. Thank you.
Yes, ma'am. 20 would be the maximum benefit, and what this bill is proposing is a $100 a month increase across the board, no matter the results. Even if someone was only getting $25 a week prior, under the current system, they would be doubled to $50 a week. And then on the max side, currently it's $275. This proposes a $300 a week maximum benefit. So we're increasing it by $25, and we've played with that, not played with it, we've considered a number of different values and how to get this equation plugged in right to where we aren't necessarily, we're not just arbitrarily fully 100% cutting, but we're also making adjustments throughout the system.
Leader Camper.
Thank you, Mr. Chairman. Thank you, Mr. Sponsor.
Yes, ma'am.
Further discussion on House Bill 1039. Seeing none, we're now voting on House Bill 1039, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1039 moves to full finance. Brings us to item number 36. Item number 36 is House Bill 226 by Chairman Vaughn. Sir, you are recognized. You do have a motion second. You're recognized for brief
Thank you, sir. This bill, we've seen through the pandemic, there's been lessons learned, some good lessons, some bad lessons. This is a workforce development bill for populating the medical laboratories across the state. What this would do is this would bring us into compliance, or similarly to several other states across the country, to where we follow the Clinical Laboratory Improvement Amendment guidelines, which are federal guidelines, as opposed to our state licensure law. In addition to that, there's a few other changes, but these were all contemplated in the governor's executive order, and what we found out was when the rules were changed through the COVID epidemic, we saw a larger workforce migrating into these laboratories, and so what we've seen is the workforce has been enhanced for these folks as a result of following these guidelines.
All right, thank you very much for this description. Members, any discussion on House Bill 226? Question's been called. Any objection called on the question? Hearing none, seeing none. We're now voting on House Bill 226, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 226 moves to full finance. Thank you, sir. And that brings us to item 37 of the Chairman Vaughn legislative package today. That's House Bill 443. You have a motion and a second. And it looks like there is an amendment by Chairman Williams. So let's go to Chairman Williams. You're recognized.
Thank you, Chairman, members. I move the First Amendment, Drafting Code 8111.
Okay, you have a motion and a second. You're recognized for a brief description.
I have one additional technical amendment to follow after. Should we put it on or?
We'll go ahead and put this one on, and then we'll put the other.
Okay. So this amendment modifies the current statute. While Chairman of Commerce was gleefully riding a farm tractor getting therapy in West Tennessee, he and I were working on this amendment. But what it does, it expands the current GME practice that's currently going on in the state, expands it by an amount of $4 million, equivalent to whatever the rate is for the going practices that are for residency programs across the state. The chairman has been actively involved with this process for the last 2 years, and so that is a recommendation of his work. Also in this bill, there's a section which provides for a new DO residency program, which would be housed at LMU, which would allow for the reinvestment of $1.5 million in reoccurring funds to stand up this DO program, which would allow for residency programs in rural Tennessee, one in each of the 3 grand divisions. With that description, Chairman, I'm happy to answer any questions you might have.
All right, thank you for this description. Members, any discussion on Drafting Code 8111? Before we go to Leader Camper, I would like to go to the sponsor, and let's hear from the sponsor to make sure he does view this as a friendly amendment.
Yes, sir, Mr. Chairman, I do view it as a friendly amendment.
All right, thank you. Leader Camper, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, does this amendment take Meharry and MTSU out of the equation?
Chairman Williams?
Thank you. No, Leader Camper. What this bill does, it just restates what the current practice is. Because the way the residency program is set up through TennCare, this just allows for the money to flow through THEC to TennCare, and it would still be distributed the same way it does for that $4 million. So currently, Meharry, Vanderbilt are able to participate in the GME programs, which are managed by Department of Health, TennCare, ETSU, and University of Tennessee.
Okay. Thank you, Mr. Chairman.
All right, further discussion on Amendment 8111? Seeing none, we're now voting on Amendment 8111 to House Bill 443. All those in favor say aye. All those opposed, no. The ayes have it. We are back on the bill as amended, and we are now back to Chairman Williams for Amendment number 2. 8128 is the drafting code I have. Is that correct?
Yes, sir.
We have a motion to second on the amendment.
Thank you, Chairman Hicks. Members, all this bill does is change the language to say they're going to follow the similar process instead of the same process that they're currently using for the GME programs at UT, ETSU, Department of Health, and TennCare.
All right, thank you for this description. Members, any discussion on Amendment 8128? Seeing none, we're now voting on Amendment 8128 on to House Bill 443. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. And Chairman Vaughn, you are recognized on House Bill 443 as amended.
Thank you, Mr. Chairman, and thanks to Chairman Williams for cleaning up the appropriation side of this equation. Ladies and gentlemen, what this new program that we're setting up will do will be allow the medical colleges throughout the state to run their own residency program as opposed to it flowing through CMS and TennCare through the hospitals. This is a managed program that the universities, the med schools will, because what we've seen is when it comes to the less lucrative medical professions, sometimes those spots, there's not enough spots for the residencies that will steer people towards those fields, leading us again in a workforce development situation to where we're actually graduating more med school students than we have residencies, which lends itself to less doctors in the future living here in our state. So that's what this bill does, and I appreciate your support.
All right, thank you very much, Chairman Vaughn. Members, you've heard the description of House Bill 443. Is there any discussion on the bill? Seeing none, we're now voting on House Bill 443, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 443 moves to full finance.
Thank you all.
Thank you, Chairman. All right, that brings us to item number 43 on our calendar. Item number 43 on our calendar is House Bill 1246 by Representative Calfee. You have a motion, a second. Sir, you're recognized on the bill for a brief description.
Thank you, sir. This is a bill that should have been done quite a few years ago, in my opinion. It's a student's right to know, and it covers the advantages of middle college or community college, TCAT, the four-year colleges, and also addresses what you can learn, what will help you in the military. And I made a misstatement here the other day. I said this is going to be managed by the Tennessee Department of Education. It'd be THEC.
Okay, thank you very much. All right, you've heard the description on House Bill 1246. Any discussion? Seeing none, we're now voting on House Bill 1246, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1246 moves to full finance.
Thank you, Chairman and Committee.
Thank you, Representative Calfee. That brings us to item number 47 on our calendar. Item number 47 is House Bill 22 by Representative Gillespie. You have a motion to second. You are recognized for a brief description on House Bill 22.
Thank you, Mr. Chairman and Committee. What this bill does is it will increase the penalty for organized street racing or drag racing from a Class B misdemeanor to a Class A misdemeanor. Right now, where I live and throughout the state and the country for that matter, drag racing is becoming more and more prevalent, and it's dangerous. And I hope that by this body taking up this matter will save lives, and I believe this bill will help save lives. And with that, any questions?
All right, thank you, Representative.
Sorry.
Members, you've heard the description. Any discussion on House Bill 22? Representative Freeman.
Thank you, Chairman. And the sponsor, thank you for bringing this. This is, we've talked about this a couple of times. This is a big problem in my district and across the state. And for those of you that have districts where this isn't a problem, you're fortunate because it's prevalent, it's damaging to the community, and it's extremely dangerous. So hopefully this will do a lot to start to restrict that. So thanks.
All right, thank you very much. Members, further discussion on House Bill 22? Seeing none, we're now voting on House Bill 22, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 22 moves to full finance. Thank you, Representative. All right, that brings us to item number 52 on our calendar. Item number 52 is Representative Hall, and I do not see him, but we will, without objection, we will roll him to the heel of the calendar. Without objection, so moved. That brings us to item number 53. Item number 53 is House Bill 713 by Representative Hurt. Sir, you are recognized. You have a motion. Second, you recognize for a brief description.
Thank you, Mr. Chairman. House Bill 713 addresses BEP funding following students that, because of a student's treatment plan from a qualified physician, are sent to an out-of-state facility. It allows the facility to receive BEP funding for educational services provided during behavioral treatment. These facilities' educational programs will be qualified by the Department of Education. It also clarifies that only when all options in Tennessee are exhausted, then the BEP funds can follow the student. With that, I renew my motion.
All right. Thank you, Representative Hurt. Members, you've heard the description. Any discussion on House Bill 713? Hearing none, seeing none, we're now voting on House Bill 713, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 713 moves to full finance.
Thank you, Mr. Chairman. Committee.
All right. That brings us to item number 59 on our calendar. Item number 59 is House Bill 9 by Representative Reedy. You have a motion and a second. You're recognized, sir, on a brief description of House Bill 9.
Thank you, Mr. Chairman and members. This is a bill that I've been working with Commerce and Insurance for about 6 years now. With that, it started out as a locksmith law, 5,000 licensed locksmith. I do want to say thank you to NFIB, AFP, and the Beacon Center, as well as Senator Mike Bell and Chairman Whitson. We have worked on this bill. What we found out was a good idea, but a bad law. With that, Mr. Chairman, I'll take any questions.
All right. Thank you for this description, Representative Reedy. Members, any discussion on House Bill 9? Chairman Williams? All right. Question has been called. Any objections to calling the question? Hearing none, seeing none, we're now voting on House Bill 9 and moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 9 moves to full finance. Thank you, sir. All right, that brings us to item number 62 on our calendar. Item number 62 is Chairman Baum. And, sir, you have a motion and a second. On House Bill 761, it looks like there's an amendment that has been filed by Chairlady Hazelwood, so we will go to Chairlady Hazelwood, Drafting Code 7751. Is that correct?
That's correct.
Do we have a motion to second on the amendment? We have a motion to second. You're recognized on the amendment for description.
Thank you, Mr. Chairman. This amendment simply changes the date. The original bill would remove the sales tax from gun safes and safety equipment. This makes that sales tax abatement run from July 1, 2021 through June 30, 2022. So it's a one-year sales tax relief.
All right, thank you for this description. Members, any discussion on Amendment 7751? Seeing none, hearing none, we're now voting on Amendment 7751 going on to House Bill 761. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. Chairman Baum, you are recognized on House Bill 761.
Thank you, Chairman Hicks. I think the amendment describes the bill. Again, this bill provides a one-year sales tax holiday on gun safes and gun safety equipment.
All right, thank you very much for this description. Members, any discussion on House Bill 761? Seeing none, we're now voting on House Bill 761, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 761 moves to full finance. That brings us to item number 69 on our calendar. Item number 69 on our calendar is House Bill 513 by Leader Gant. You have a motion and a second. Looks like, Leader, you have an amendments 8124. Is that correct?
That is correct.
All right. We have a motion and a second on the amendment. You have a motion and a second. You are recognized on the amendment.
Thank you, Mr. Chairman and members. What this amendment does is it just simply names this piece of legislation Law and Order Act of 2021.
All right. Thank you for this description. Any discussion on Amendment 8124? Seeing none, we're now voting on Amendment 8124 going on to House Bill 513. All those in favor say aye. All those opposed, no. The ayes have it. We're back on the bill as amended. Sir, you're recognized.
Thank you, Mr. Chairman and members. What this piece of legislation does is it's got 4 sections, and I'll go through these as briefly as I possibly can. Mr. Chairman, the first section increases the penalty of incapacitating a highway or other passageway to a Class E felony and a mandatory fine of $3,000. Section 2 creates criminal immunity for prosecution for any drivers who are exercising due caution who unintentionally cause injury or death to a person illegally obstructing a roadway. Section 3 creates a Class A misdemeanor for a person who throws an object at another with the intent of harming the other person while participating in a riot, and a Class E felony for a person who throws an object at another and causes bodily injury while participating in a riot. Section 4 creates a Class A misdemeanor for a person while participating in a riot who intentionally intimidates or harasses an individual in a public place who is not participating in the riot.
All right, Leader Gant, thank you very much for this description. Members, any discussion on House Bill 513? Representative Freeman.
Thank you, Chairman. Question to the sponsor. So it removes is the word I'm trying to say. Removes the liability from somebody if they are driving through someone blocking the road and unintentionally injure them. Is that did I understand that correctly?
That is correct.
Representative Freeman.
So following that same rationale, if I'm being blocked, say coming into the Capitol, and I'm using due caution, but I've pushed my way through, my understanding is today that is assault if you bump into someone like that. Why would we remove the same protection we have from somebody with their body running into somebody that I'm not likely to cause death or heavy bodily damage, but yet we're removing that. What's the reason for removing this liability?
Leader Gant.
Thank you, Mr. Chairman. This portion simply targets bad actors who refuse to allow innocent individuals who would like to remove themselves from a potentially dangerous situation to do so.
Representative Freeman.
And so someone exercising their First Amendment rights, is it now fair to say that they have reason to believe that they could lose their life from someone?
Leader Gant.
If somebody driving like the example you just gave and they intentionally target somebody, they're going to jail.
Representative Freeman.
So saying intentionally target, if I'm driving down the road and there's a march that's blocking the road, I get that. But if I'm just ready to leave and I feel threatened, I'm authorized to begin to drive for. Can you explain the process with how that would operate?
Leader Gant.
Just like in any other situation now, before this legislation, there's going to be an investigation, and the judge would make that, and jury would make that call if it goes to that point in the law.
Representative Freeman.
Yeah, I guess I appreciate the some pieces of this bill and understand kind of where this is coming. I just have a great deal of issue with us giving any situation. I mean, we had in Virginia, there was a gentleman who drove through a crowd. I know that's not directly what this is, but it would at least give a path for them to have to prove that it wasn't intentional, potentially. And I genuinely appreciate you and the work that you do, but I think that I think we're better than that, than this bill here in Tennessee, and I'll be voting against it and would encourage anybody else who agrees with me to do the same.
Leader Gant.
Thank you, Mr. Chairman. I think that, I can think of many examples where if you intentionally target somebody just because you don't believe with the political banner that they fly, and you specifically target somebody that's on the sidewalk, in the street, you're going to jail for that. And right now, before this legislation, we have a full investigation that takes place, and this doesn't change that. So.
All right, thank you very much. Further discussion on House Bill 513. Seeing none, we're now voting on House Bill 513, moving on to full finance. All those in favor say aye. Aye. All those opposed, no. The ayes have it. House Bill 513 moves to full finance. All right, that brings us to Chair Lady Hazelwood. Chair Lady Hazelwood has item number 74 on our calendar, House Bill 130.
Thank you, Mr. Chairman, and this bill does have an amendment.
Okay, do we have a motion to second on House Bill 130? We have a motion to second. Then we do have an amendment, drafting code 7755. Is that correct?
That's correct.
Do we have a motion to second on the amendment? We have a motion to second. You are recognized on the amendment.
Thank you, Mr. Chairman. And this is a bill with which all of you are very familiar, and I won't make you wait through me on my soapbox one more time. But just briefly, this is the bill that will raise the payment for those folks, our DSPs, who care for the developmentally disabled in this state. It will bring their pay up to $12.50 per hour, which is a big increase from the $10 that they're paid now. I would submit that this is a great battle won, but there's still a war to be fought, and we'll continue to work on that going forward. With that, I'll redo my motion.
Thank you very much. And you've heard the description of the amendment 7755. Any discussion on the amendment? Seeing none, we're now voting on amendment 7755 to House Bill 130. All those in favor say aye.
Aye.
All those opposed, no. The ayes have it. We're back on the bill as amended, and I think you just heard the description of House Bill 130, but Chair Lady Hazelwood, you're recognized.
That was the description of the bill as amended, and with that, I would again renew my motion for adoption.
All right, thank you very much. Members, any discussion on House Bill 130? Question has been called. Any objection to calling the question? Hearing none, seeing none, we're now voting on House Bill 130, moving on to full finance. All those in favor say aye.
Aye.
All those opposed, no. The ayes have it. House Bill 130 moves to full finance. And members, I'm going to back up just for 1 second, and let's go ahead and grab item number 23. Item number 23 on your calendar is House Bill 1433 by Chairman Holzclaw. Chairman, you have a motion and a second. You're recognized for a brief description on House Bill 1433.
Thank you, Chairman, committee members. 1433, basically what it does, it enhances the penalty to a Class C felony when a person discharges a firearm within a motor vehicle is the purpose of this.
All right, thank you very much. Members, you've heard the description. Any discussion on House Bill 1433?
Question on bill.
Question's been called. Any objection calling the question? Hearing none, seeing none, we're now voting on House Bill 1433, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1433 moves to full finance.
Thank you, Chairman, committee members.
Thank you, sir. All right. Members, let's go ahead and grab item number 52. Item number 52 is House Bill 1044, and that's going to be handled by Chairman Todd. Chairman Todd, you're recognized on House Bill 1044. You have a motion and a second. Please continue with a brief description.
Thank you, Mr. Chairman. With the amendment 4984 that's, I believe, traveling with it.
That's correct.
It increases the number of commissioners to the Tennessee Public Utility Commission from 5 members to 7. It requires that any new commissioner being appointed have no experience in a regulated utility industry, and increases from 30 days to 90 days the amount of time the General Assembly has in confirming the commission members.
All right. Thank you, Chairman, for that description. Members, any discussion? Chairman Baum.
Thank you, Chairman Hicks. Chairman Todd, my question is what's the advantage to having commissioners on this committee who have no experience with regulated utilities?
Chairman Todd.
Thank you for that question. I'm sure there are multiple reasons, but I think just like in a lot of committees and a lot of boards that we have in the state, having some folks that are from outside of that particular interest may bring a different perspective. Just for example, in some of our committees, on an ag subcommittee, we have a member that doesn't have much to do with ag in his life or career, yet brings a very unique perspective that has really helped us on some legislation even this year. So I think that's just having a different perspective and providing some a different point of view that the public, I think, would want introduced into those board meetings.
Thank you, Chairman Todd. I appreciate that answer, and I appreciate you handling this bill. There have been a few people who have brought this to my attention, that they have a concern that it's maybe unusual to prohibit a member of the committee from having any experience at all. I could see how you might want a committee that has some members that have experience in regulated utilities and some committee members that don't have experiences. This bill would seem to prohibit anyone with any experience in the industry from serving on a committee that addresses the industry.
Chairman Todd.
I don't think that's the intention. I think and I'd have to double check the wording to make sure, but I don't think that's the intention of the bill, as I understand it.
Chairman Baum.
Thank you for that. And if you get any new information on that, let me know. I guess I've registered the concern for the record. And again, if you find out anything else, I'd appreciate finding out. Like maybe a staff attorney for a regulated utility, would they be prohibited from serving on this commission? Thanks.
Thank you. Representative Ogles.
I was just following up to the previous comments. So does that mean all appointees after this fact will have to have no experience? Or I'm a little confused to that, to the sponsor. Thank you.
Chairman Todd.
I would point to one of the lines in the bill, except otherwise provided in the previous subsection. Each commissioner must have a bachelor's degree and at least 3 years experience in a regulated utility industry, in executive level management, or in one of the more following fields: economics, law, finance, accounting, or engineering. One appointee of the Speaker of the Senate and one appointee of the Speaker of the House of Representatives in subsection A3 must be a public member with no experience in a regulated utility industry.
Representative Ogles.
Thank you for that clarification.
Thank you. Members, further discussion on House Bill 1044. Seeing none, we're now voting on House Bill 1044, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 1044 moves to full finance. All right, that brings us back to item number 77. Again, I appreciate your patience there. Wanted to pick these two up. All right, item number 77 on our calendars, House Bill 975 by Chairman Williams. Sir, you are recognized. You have a motion to second.
Thank you.
And Chairman, it looks like you've got an amendment drafting code 8023. Is that correct?
Yes.
Do we have a motion to second on the amendment? All right, you have a motion to second. You are recognized on the amendment.
Thank you, Chairman and members. Many of you may have heard that NASCAR intends to bring racing back to the historic Fairgrounds Motor Speedway in Davidson County. This legislation allows for such races and related events to be held at the Fairgrounds Motor Speedway to be treated in the same manner as all the other sports-related events in the state when it comes to the tax structure. This bill would authorize events at the Speedway in Davidson County to be included in sales tax, local option sales tax, local seat privilege tax, structures currently permitted in Tennessee Code for these sports venues. With that, Chairman and members, I'm happy to answer any questions you might have.
All right, thank you, members. You heard the description of the amendment. Any discussion on the amendment? Seeing none, we're now voting on Amendment 8023 being put on to House Bill 975. All those in favor say aye. All those opposed, no. The ayes have it. We are back on the bill as amended, and sir, you are recognized on the bill, House Bill 975, and I think you've already gave that description. So, members, any discussion on House Bill 975? Question's been called. Any objection to calling the question? Hearing none, seeing none, we're now voting on House Bill 975, moving on to full finance. All those in favor say aye. All those opposed, no. The ayes have it. House Bill 975 moves to full finance. Thank you, Chairman. All right, members, that completes our calendars, and I'm going to go to Chairman Hawk.
Thank you, Mr. Chairman, and great work today. Would it be proper to request that all bills not taken up on the behind-the-budget calendar be taken off notice to save those representatives a bill slot next year?
Sir, I think you just made that motion. Is there a second? So without objection, so moved.
Thank you.
Thank you. All right, let's go to Chairlady Hazelwood.
Thank you, Mr. Chairman. Finance Full will meet at 12:25 in this room, and all bills that were passed today from sub to full will be heard in the full finance meeting. We'll be working off the same calendar. We'll save a few trees, plus we don't have time to reprint. So please hang on to your calendars, and please be back here at 12:25. Thank you, Mr. Chairman.
Thank you. And before we leave, hold up one second, if you would. I do want to thank, I'm not sure you know how it goes, that we get to this juncture of session, so we may or may not have another Finance Subcommittee meeting, and I do want to make sure we thank a few folks. I do want to say thank you to Budget Director Peter Muller, also Fiscal Review Krista Lee Karsner, Attorneys Joel Hayes, Lovin Middleton Dunn, my assistant Kara McMahon, Research Analyst Myrna Tunich, Tanner Poss, also want to thank him. Also, we want to thank the folks with the Library and Archives, and certainly we do want to thank our Sergeant of Arms. And also want to thank, and the young lady walked out, her name was Miriam, and she was the lady that was cleaning the mic today. And I'm telling you what, I think of everybody in here, she was working the hardest. So, and our cleaning staff has done that all year. So we do want to certainly say thank you to those folks as well. So let's give these folks a hand. Chairlady Hazelwood.
Thank you, Mr. Chairman, and we would be remiss if not thanking our chairman for leading us through Budget Sub this year. I think it's gone remarkably well, and we thank you for your leadership.
Well, thank you. Thank you, and I hope you didn't just jinx us for the next couple of days. So with that said, without objection, we stand in recess.